Super. Got a diverse group here. Great to have social services and government, strong education, healthcare peeps have welcome to you, community volunteers. Great. And if I've missed any other poll reports, your lovely pictures are maybe in the way of me viewing any other further results. Did anyone have anything to share with those results before we get moving on? All right, super. Let's go ahead and dive in, Jeff, if we could, by moving along and meeting our PAYS expert panel. These are people that hopefully by now are becoming familiar faces to you, but welcome to any first-time attendees at our first Wednesday webinar. We want to take a look here. We have Jeff Colchin from PCCD, obviously Pennsylvania Commission on Crime and Delinquency, and Jeff serves as our PAYS project lead for the Commonwealth. So he is awfully busy communicating the goodness of PAYS throughout the state and leading that charge. Dr. Rose Baker, our PAYS principal investigator from Penn State University. Rose is always so diligent, and she attends our meetings on the back end. So she'll probably be jumping in chat if we have any questions specific to the survey itself or some data related questions. We have Mary and Kelsey from Bach Harrison, our survey vendor. And I'm not sure that they can make it on the call today. They have a conflict, but we'll be happy to provide any direction we can if you have a question that's pointed towards Bach Harrison. Sophia, we certainly couldn't do any of our work without Sophia from EPIS. She is our training and meeting support assistant. And of course, a familiar face down there in that corner, Phyllis Law. She's with us today. She'll be offering a lot of her expertise in the chat, and she's obviously welcome to share it verbally as well. But Phyllis serves as a senior systems change specialist with EPIS, and she's the voice and face of PAYS across the state. I'm Kelly Burke. I'm also with EPIS as the PAYS support and development coordinator. So let's move on to meeting our presenters for today. We're excited to have Meghan Blevins and Jeff Hogan with us, both systems change specialists with EPIS. And along with them, we're going to have two special guests that I'm kind of keeping as a little bit of a surprise here, but soon we'll hear from voices from the field, one from Montgomery County and the other from Mercer, where the two guests will be offering a cross-systems approach, and also we'll get a taste of hearing about juvenile justice and their use of PAYS as well. So a lot of great stuff in store for us in this next 60 minutes. All right, so let's dive in and trying to set the tone from where we left last month. If you were with us last month, we really focused then on team development, developing your PAYS data team, bringing sectors and different partners to the table. Well, now we're at the table. We're at the table, and we will be focusing in on strategic planning, and that's currently occurring in our communities and our counties and our schools with a host of diverse sectors, and how PAYS may enter in or link up to inform our decisions, of course, help us select our programs and strategies, and bolster our protective factors. Today on the call, we're going to be identifying where there might be integration points with these multiple data sources, and also uniting. We know uniting not only with strategic planning, but even communication planning, that can add so much value. So we're not operating in silos, and we're truly strategically coming together in an effort, obviously, to have the greatest impact. And then finally, we'll be looking at ways that PAYS drives sector work. So that's our assignment for today. We hope it sounds appealing to you. And I would like to hand the mic over to Jeff Hogan. Jeff.
Good afternoon, everybody. started this slide with a little bit of an image and a quote for us to start framing our thinking today. Alone, we can do so little, but together we can do so much. One of the things that we'll talk about today is the different data sources and how we can pull those together so that as communities, we can use what we have at our disposal to make the best decisions possible. And I loved specifically the little picture at the bottom where the people kind of each one are holding a piece of the puzzle. And if we think about that in terms of our work, we have a lot of data available across so many different sectors that we work with. If we think of each of those being one of those, those little pieces of the puzzle, who's missing from your puzzle that can bring a point of data that can help you to make the best decisions in your community? Who else is working on a strategic plan that can use the piece of the puzzle, pays, for example, or other data that you have available through your work that you can help to complete their puzzle? So I just wanted to share that to start our thinking today. So first, we're going to talk about how PAYS converges with current strategic planning efforts. And on this slide, you've seen us or heard us talk in several ways on these PAYS webinars and other planning meetings to talk about the different sectors to engage across the community. And if we think about this in terms of our PAYS efforts and other strategic planning efforts going on in the community, picture right now as you're looking at your PAYS data or you're doing a strategic plan. Maybe I saw a lot of people in different sectors such as education in that first poll. As you're working on some of your strategic plans, who are you using data from? Which sectors are you engaging in your work? We recognize that some of those are probably a pretty natural fit. Others might be more difficult to engage. And Sophia, if you would launch our second poll, we'd actually like to hear from you. What are those sectors that you struggle to engage? And this is a poll where you can select all that apply to you, one, two, or all of them if that's the case. But which sectors do you struggle to engage? So as I wait for those responses to come in, I want to mention just a couple of things on this slide. We can think of this a couple of different ways. We all have different positions. We all have different life experiences. In our positions and our job titles, we have access to different data sources. And thinking about what other data sources can help us. So just to give a couple of examples, if you're working right now in a community coalition, and let's say you're really focusing on the opioid overdose problems that we've heard so much about for a number of years, we can pull some of that information from the PAU survey. And if we look around, what other points of data might be useful for you if you're working on as a community coalition to reduce opioid overdoses? Feel free to throw your answers in chat. Which other sectors have data that you could use? Awesome, thank you. I see the poll up now on my screen. So what are the most difficult sectors? Youth and parents, business and media. Law enforcement can be difficult to engage. Religious and fraternal organizations, great. So this can help to frame your efforts around which are the ones that others are struggling with as well, and how can we work together to engage those. So just as an example from the earlier question, if you are working with a community coalition to reduce opioid overdose deaths or use in your community, you might look at data from, say, law enforcement, how many, and emergency medical and health professionals. What are the rates of overdoses occurring in the community? How many arrests are we seeing for those type of drugs being trafficked? There's a lot of other data around that. And if we flip the script conversely and think if you're in a community coalition, what if your school is looking at bullying and the rates of bullying that are occurring in your school? Now, this is a bad example because schools are really, really good at using PAYS data. But if we can picture for a second, if they aren't using their PAYS data for that, they're missing out on some opportunities because PAYS provides the means for youth in the community to say what's going on. And things like bullying, they get to share information about how often it's occurring, why do they think it's occurring, where is it occurring at, and that data can all add value to other strategic plans. So we put together a list to start our conversation today, and we recognize that it's not an all-inclusive list. But there are a lot of sectors and systems and strategic plans going on across your community. And all of our communities look different. For some of you, you might think of your community in terms of the town you live in, or the county that you live in, or the city that you live in. So just think in terms of your community, that however you define it is okay. The schools in your community, they're using pays in a number of different ways. Well, I just gave you an example of one way they might use that. Another you're going to see in a slide in just a second through PD's school improvement plan gives them some opportunities to use pays. I've also heard of a school that used their pays information to inform their Chapter 339 plan through guidance, which is their career readiness plan. Underneath that, we see some community, family, and individual strategic plans that are happening in your communities. Just a few examples, CTCs, which use pays a lot, and getting the CTC coalitions to work with those other data sources outside of pays. Human Services with their drug and alcohol needs assessment process, with the Children's Roundtable strategic planning. Juvenile Justice has a lot of ways to link with our pays data, children, youth, and families. Cross systems, Parks and Rec, and even law enforcement, they're able to pull a lot of value in the work that they're doing with their strategic plans from the PAU survey. Now, we like to think we're pretty good at coming up with lists, but we recognize this is not an all-inclusive list of those strategic plans across all the sectors and systems in your community. Please feel free to in chat, what are some other examples in your communities that other sectors or systems or strategic plans can make use of the data in pays? Great, thank you for sharing. I see some questions in there. Phyllis or anybody, if I miss any, I have trouble with chat doing this on one monitor sometimes. Feel free to let me know if I miss a question in chat as well. Yeah, Shantae, great. Parks and Recs is one that I didn't think of initially. That's a great example. Okay, so keep thinking about those. I'm sure there are other systems, sectors, strategic plans happening in your community right now that maybe aren't using or don't even know about something called the PAU survey, and how can we work together to complete that picture? As the last slide kind of said, working as a community to solve those problems together, to find solutions. Great, thank you. Keep those coming in chat. Those are great ideas. This next slide is kind of the steps for our SCA needs assessment. And I'm not going to spend a ton of time here, but I would like to see in chat, these outline the 6 phases of the SCA needs assessment process. So as we think through phase A and B being what are the problems, phase C being why are the problems occurring, D being why are the problems occurring here, E being what resources are available, F being what are we going to do, and G is our plan having the desired impact? Where do you think that pays may add value to this strategic plan? Which phase or phases can you see pays being utilized? G, A for sure, all levels. I don't think there's a wrong answer to this. I think you can make the case, and actually the first answer being G, I had to think for a second, like, okay, how would I use pays there? But pays could potentially be used to evaluate, are you seeing the desired impact for those changes depending on what your plan consists of? That's a great example. And it can be used across those, some of the ways I wasn't even thinking. Thank you all for your answers. The next, did I skip a slide? Yes. Went 2. So the next slide is an example of the Pennsylvania Department of Education's cycle of school improvement. If we look at the cycle of school improvement, setting the direction, assessing the needs, creating a plan, implementing the plan, monitoring the plan, and adjusting course, where might schools and PDE use the pays information in their cycle of school improvement plans? Please feel free to keep just throwing those in chat, what ideas you have. All of them, Wendy. Yeah, I think you can make the case that you would use the PAYS data in all or most of those steps, probably starting with using that a lot in assessing the needs. Thank you. Yes, PAYS would be great in seeing those root causes, seeing what the youth are telling you is happening, and using that to piece together the bigger picture with all the other data sources that we know are out there. And we're starting to see these, these strategic plans and these different processes that are out there, they start to look pretty similar. We have another one that is familiar to a lot of you that I've worked with on the call, the CTC strategic plan. And this lays out the 5 phases of the CTC process on the screen. So this one may be less obvious if you don't work directly in CTC, but feel free, there are no wrong answers. Where do you think in this process, and feel free to answer if you're familiar with communities that care or CTC or not, where would you use PAYS in the CTC system that we see on the screen? All of them again, Wendy. If you had to pick one major one, where do you use PAYS a lot, in which phase? 3 and 4, great. Yeah, really around those middle phases, you do a lot of analyzing what your community's needs are and looking at ways to fill those gaps. Again, you probably are going to use it in every single phase. And it's just another example to show how it links up with these different strategic plans, which there may be some happening in your community right now that you're not even aware of. So next we are going to dive into where to find integration points across multiple data sources. And I have the pleasure of introducing my friend Kelly Canally today to share with us some of her examples from using this information hands-on.
Thank you, Jeff, very much. And thank you for asking me to come on behalf of the Cross Systems Prevention Work Group. Welcome, everybody. I see some definite familiar faces, and I miss seeing all of you in person. So I have the pleasure of serving with the Cross Systems Prevention Work Group since its inception about 4 years or so ago. For those of you who are not familiar, and Jeff, I think we could probably go to the next slide. For those of you who are not familiar with the Cross Systems Prevention Work Group, we are a statewide, I would say, coalition committee of policymakers, state and county leaders, human services, coalition representatives that are really looking at putting this idea of utilizing data-driven decisions and making primary prevention a focus at the state level, just as many of you have been doing through Communities That Care and other initiatives at the local level. We are looking to have the same level of coordination at the state. So when those are making funding decisions, programming decisions, that primary prevention can become a focus for those efforts. So we use PAYS in a number of ways. And if we want to go to the next slide, we've used PAYS and as well as data that we gathered through our State Department partners and all of you through a data gathering activity that we did back in, I believe it was 2019, I think it was pre-pandemic, to really assess what the state is for youth problem behaviors in Pennsylvania. So PAYS is definitely the primary tool we utilize when we are looking to define goals as well as recommendations for the field moving forward with regards to preventing youth problem behavior. So Cross Systems Prevention Work Group is really focused on 6 core areas, which are substance abuse, delinquency, school dropout, teen pregnancy, violence, and then depression and anxiety. All of these, for those of you who know PAYS, comes right out of the PACE survey itself, which provides extremely valuable information to us through the statewide report on what our youth are experiencing regarding these factors. So, and I think Sophia put in the chat, there is a page for cross-systems prevention work group for those of you who are not familiar on the Epicenter website. And Sophia put that link in the chat for all of you to get some more information. But one of the most recent reports that we've released is the risk and protective factor assessment. These are the goals of that, but one of the other recommendations in this report, and one of the primary recommendations in this report, is the use of data-informed decision-making. And the report makes several recommendations regarding the use of data and data collection methods and outcomes, and PACE is really a primary focus of those recommendations. So that is how we're using this at the state level. All right, I think I'm handing it off to Jeff, or Josh. Josh Leskovac is our chief for Mercer County Juvenile Probation. Josh has also been extremely involved in coalition prevention efforts and in Mercer County. And I will now hand it over to Josh.
Okay. Good afternoon, everybody. I suppose I need to first start by apologizing for everybody having to look at my picture the entire time. I know that's the worst part of me presenting. I don't have any slides, so we're just trying to get through the information, and I want to pass this off to you guys as quickly as I can. I am the Chief Juvenile Probation Officer here in Mercer County. I'm also the chair of our county's Communities That Care Coalition and the chair of the Pennsylvania Council of Chief Juvenile Probation Officers Diversion and Prevention Committee. And I feel like I need to preface, the whole discussion here on my end with the fact that I've only been chief of our department since the end of 2020. I have only recently also become the chair of the Diversion Prevention Committee through the Chiefs Council. And really everything that I'm going to present to you today, for the most part, comes about as a joint effort between many different agencies in Mercer County, and with particular thank you, I suppose, to my prior chief, Mr. Mark Benedetto, who anybody involved in prevention has probably come across his path at one point or another. Mark was an extremely insightful and proactive person in the field of prevention, but also in juvenile justice. So prevention has been in juvenile justice, at least, documented with our juvenile justice system enhancement strategy since 2010. But there really wasn't a whole lot of emphasis on prevention because we had so many other tasks that we had to take care of. Mark, around 2014, 2015, approached the Chiefs Council and asked for there to be another committee created, which would have been the Diversion and Prevention Committee, where he wanted to get probation departments and juvenile justice to spend a little bit more time on prevention activities. And of course, they thought that that was a great idea, but said, if we're going to do that, then you have to chair this committee. Mark graciously accepted that and ran with it for quite a while. When he retired at the end of 2020, Ted Rice from Bucks County took over for a while, but has recently had to resign due to some other county activities. So now I'm in that spot. So really, again, all of the activities I'm going to outline here started with Mr. Benedetto and our Communities That Care Coalition, our single county authority. Ms. Kelly Burke is on the committee at EPIS right now, but used to be play a huge role in the prevention arena in Mercer County. And in Mercer County, the PACE data has sort of been the pinnacle of all data that we receive, and we sort of surround it with all of the other auxiliary or supplemental data. For prevention, the PACE data, again, is the primary source countywide. But for the Juvenile Probation Department specifically, we take that PACE data coupled with our own YLS risk assessment data, coupled with referral data and allegation data that come in. We look at data from district courts. We look at data from our sister agency and children and youth services, and then try to determine all of the trends that are happening. Starting in 2009, our Communities That Care organization noticed that we had some family management problems. That was the primary risk factor in PACE. And simultaneously, we started our risk assessments and started noticing there were a lot of family issues there as well. The CTC Coalition identified Strengthening Families Program 10 to 14 as a potential prevention program, evidence-based prevention program. Brought that into the county, and it's still currently running. The interesting part is that at the time, that easily could have probably been passed off to agencies that were normally used to dealing with prevention, but our chief, Mr. Benedetto, actually sent 6 of our probation officers to the training for Strengthening Families program to become facilitators and fidelity observers. And currently to this day, we still have 6 facilitators that rotate, helping to facilitate that program in our county. It is facilitated 4 times a year in different regions throughout the county. So we're pretty excited for our department to still be involved at that universal prevention level. So in 2015, when we're looking at PACE data, we're still noticing that there's some family management problems. We're also noticing in our department that there's disproportionate minority contact with our African-American population. And then when we're taking a look at the Strengthening Families program, we're noticing that a lot of our African-American families just simply weren't attending the program. There were either transportation barriers or potential cultural barriers. So our CTC organization and Mr. Benedetto started doing some research, and they found the Strong African-American Families program, which is essentially a more culturally sensitive version of the Strengthening Families program. So beginning in 2016, Strong African American Families program came into play. Mr. Benedetto and CTC wrote a grant and then eventually got that funding incorporated into our needs-based budget later on down the line, and it's still operating again to this day. Again, unique to our department, we do have one probation officer that actually assists with some of the facilitation in that program occasionally, and also is trained to be a site coordinator to fill in whenever needed for that particular program. So 2015 PACE data gave us a ton of information. And for those of you that may not know, right around 2013, and guys at EPIS, correct me if I'm wrong, I believe they started incorporating some questions around depression and suicide and anxiety, potentially even some bullying stuff. We started seeing, lots of issues that were quite alarming with the number of students that were reporting anti-bullying, reporting depression and suicide attempts, thoughts of suicide. So our CTC coalition, again, along with some of the juvenile probation folks and our single county authority and all of the other human service agencies in the county, started taking a look at other programs. Our Communities That Care mobilizer located a program called AVITM. AVITM is essentially an after-school club for students that originated in Lancaster, PA, and the term AVITM is a fabricated term by that group that stands for I've Got Your Back. Our CTC coalition and the mobilizer, along with our single county authority, brought in folks from Lancaster to do a huge kickoff event at our IU unit so that we can bring in members of the student body from various school districts to gain interest. Ultimately, as a result, over the last few years, there's been 8 of our 13, 14 school districts, whether you include the charter and parochial schools, but 8 school districts actually took on the AVITM Club. So we're pretty excited about that being there. Our chief at the time, recognizing that the AVITM clubs may need some assistance from occasion, let them all know that our JPOs could be available to them upon request. And over the years, we've helped the AVITM clubs with a few different things. We've helped with fundraising efforts. Multiple school districts have had fundraisers where they've had big events. We've helped to provide a little bit of the security there. We've helped get posters and flyers printed, some of that through our own county money, dollars here. We've helped with the acquisition of buddy benches, pillows and other comfortable chairs that we've been able to pick up for some of the school districts, put together what they called camaraderie corners, where youth can sit and talk. And we've also helped to acquire some prizes for a VEDM Club, prizes and contests that they put together. So our officers are readily available to those clubs whenever they need some assistance. By the time we hit the 2017 PAYS data, one of the big risk factors that popped out to us was a low commitment towards school. Simultaneously, we're looking at district court records, we're looking at our own department records, and we're realizing that truancy is continuing to increase, continuing to be a problem. We're starting to find more and more kids dropping out. Some of our referrals, we're having kids come in that are, 2-3 years behind in school. So clearly that became one of our top priorities. One of the things that our chief at the time said was, we should really get involved with these student assistance program teams, the SAP teams. So he reached out to our single county authority, reached out to the school districts, and they welcomed us with open arms. We got trained. And currently right now we have a JPO sitting on every SAP team in the entire county. So we've just divvied up our probation officers, signed them to each school district, and now we're in there. The idea behind being on the SAP teams is that we can increase our communication with the schools. We can determine if there are any problems coming up, particularly in the area of truancy, and hopefully help the teams and school officials to brainstorm some solutions to that. By the time we hit 2019 PAYS data, we're still seeing as a major risk factor as being that low commitment to school. So our chief reached out to our local CYS and also the Department of Human Services and asked for a truancy task force to be put together. He assigned me at the time and another probation officer who is now the deputy chief of our department to that particular task force. And we've been working with our local CYS and our district courts now for about 2 years. It's gone very slow, mainly because of the COVID pandemic, but working toward developing some outreach to school districts, developing a standardized approach to dealing with truancy, and developing some prevention programming to put in place in each of the school districts revolving around truancy. So we're excited because we know that we have some manpower. We know we have some people available in our department that we can dedicate a little bit of their time and energy and creativity towards some of these tasks. So we're looking forward to seeing, what that task force will ultimately bring. Most recently, we come into Mr. Benedetto retiring in 2020, and I'm going to go real quick now, and ultimately taking a look at all the PAYS data in aggregate from across the years and noticing that our referrals at CYS are increasing for females. So actually in our department, we went from about 21%, anywhere between 17 and 21% referrals with females in our department up to 41% this past year. So we noticed there's a lot of things going on with females. We're taking a look at the PAYS data, showing again a lot of the depression, a lot of the bullying experiences, a lot of people having anxiety. And then we take a look at the data out of CYS showing that we're dealing with more and more runaways that are females. We're dealing with more and more girls that are attempting suicide, that are coming to them, having experiences with truancy and having issues with, sexually acting out behaviors at a very young age. So we looked for a female-specific program, and we found Girls on the Run out of McGee's Women's Hospital, and ultimately, very curious about the program, had all of our probation officers trained for free. McGee's came up, trained all of our POs for free, and we assigned each of our POs to be coaches or assistant coaches to run pilots of the program throughout the county. So we ran the Girls on the Run after school program for girls 4th through 6th grade, and we ran the Heart and Soul after school program for girls in 7th and 8th grade. And then in the summertime, we ran 2 camps, 2 week-long summer camps for Girls on the Run in 4th through 6th grade. We fell in love with the curriculum, or CYS fell in love with the curriculum. Then we ultimately approached DHS through our needs-based budget and requested that that program be incorporated into the promising practices portion of the needs-based budget. and got our family centers to write a contract up to provide that programming countywide in all of our school districts. So in July 2022, they will be focusing on trying to get the 5 largest school districts involved with the Girls on the Run after school programs and the summer programs. So ultimately, we have staff that are trained to facilitate the Strengthening Families program, the Strong African American Families program, Girls on the Run, the Heart and Soul program, and assist with the VEDM clubs. We have active local membership on other prevention teams, such as the CTC Coalition, our Criminal Justice Advisory Board. We're on our SAP teams. We're on our truancy task force. We have membership on the overdose prevention work group through our SCA, and also the suicide prevention work group through the SCA. And we have active statewide membership on the PA Council of Chief Juvenile Probation Officers, Delinquency Diversion Prevention Committee, Cross Systems Prevention Work Group with Ms. Canally just talked to you about, and on our diversion subcommittee. So even though juvenile justice isn't the be-all, end-all to prevention, and never should be, I suppose, our county, and particularly with the guidance of our prior chief probation officer, has shown that we really can find ways to get more involved in the prevention field and help out in many different ways. So I guess that's all. Take any questions. If no questions from me, then I'd like to hand it over to Meghan Blevins, who is the systems change specialist at the Epicenter. Thanks, Meghan.
Thanks, Josh. And we'll have a little bit of time, at the end for questions, put them in the chat. Appreciate all your perspective, Josh and Kelly. Prevention in juvenile justice is a newer conversation, so it's nice to hear how far, you all have come in such a short time. So it's my job, I feel, at this point to really tie together a lot of things that we have already mentioned, we've already talked about. I, of course, would like your input. But what we're looking at here is just what we're going to be looking at is, again, a couple examples as how different sectors are utilizing PAYS and what reports are really similar in determining some of these things. One thing I really want us to keep in mind as we're going through this is, all of the different sections of PAYS. It's not just looking at school data. It's not just looking at drug and alcohol. It's not just looking at community, but really that holistic view of everything that's going on within a youth's life, every part that touches a youth's life. So really want you to keep those things in mind, especially when it comes to schools. I know that I'm repeating myself and probably others, but just because this data happens in the school does not mean it's just for the school. A school is, the school data is a subset of what's going on. So just a couple examples, and please put yours in as well. This is by no means an exhaustive list, but just a couple of ideas as to how schools do incorporate the PAYS. Different ideas that we heard is, sharing that idea with community partners. Since the survey is done at the school administration are really the holders of that information. And, it's up to you all and your community members how you decide to disseminate that information to folks in your community, those other sectors that we have been talking about that use these materials. And better yet, one of our favorite words, but collaboration. How are we going to collaborate? Jumping back to how Jeff started us off with our quote. So really thinking, in the world of collaboration. So I believe it was Josh, you mentioned this, but looking at student assistance program data, PAYS can be a jumping off point for those data points, might be able to fill in some gaps. Any sort of discipline data. So maybe looking at a little bit more of, the schools do such a great job with collecting data, so as it is, and then you have an extra layer of the Pennsylvania Youth Survey data to help with those things. If you're seeing a large truancy rate, if you are seeing a lot of maybe free and reduced lunches, the PAYS can help you take that a little step further and maybe find out that why. Guidance reports, student voice. There's a lot of different ways. This is one of my favorites, the student voice, and I'm going to put building positive social norm campaigns. You know, we have seen students across the state do so many creative things with this data. They understand the data. They, and know whenever I've done things with students, I just, you know, give them a quick framework and I pass it over to them because their ideas are nothing to what compared to what I can come up with. So one thing that we see a lot is just that youth voice. You know, they hear a lot from us as adults, but passing that information over to youth so they can share things with their peers. What we've also seen is, you know, it's very easy to look at the kind of negative side of data. If we're looking at, you know, just as an example, 11% of our 12th graders have used alcohol in the past 30 days. Well, if we flip that over, 89% have not used alcohol in the past 30 days. Students do a great job wording that and, you know, creating, I've seen so many creative ways that they've been using it. You know, Jeff already did talk about this. Again, the school improvement plan from PDE. There's so many different opportunities throughout that cycle that the data can be used. I'm going to just take a minute and I'm wondering if you all can put in any other ideas that you have about how students can, or excuse me, still stuck on students, schools can incorporate the PAYS and the different initiatives that they have. And keep adding those in, of course, as I keep talking. Jeff, if you wouldn't mind the next slide. Thank you. So I'm going to ask another question. You know, another sector that we're looking at are social services. I noticed when you did the polls at the beginning, you know, we have quite a number of folks, you know, not only from education, which we just talked about, but social service sector and health sector as well. So one thing we want to think about, and a big example is around the social determinants of health. So I'm kind of curious to see if you wouldn't mind putting in the chat as well, what other ways do social service include the PAYS? I don't, Jeff, I'm going to have you go to the next one. I'm going to touch a little bit more on the social determinants of health. So if you aren't familiar, here's a couple different ways that they can be used. So looking at that economic stability, social and community context, neighborhood and environment, you know, we have a whole domain for that. Healthcare, which I saw, that was one of the top 3 sectors that was represented today on the call, was that healthcare sector, and of course, education. So when we're looking at specific examples of what these social determinants of health are, we're looking around safe housing, transportation, which translates over to transitions and mobility within the PAYS, and within their neighborhoods, safe neighborhoods, racism, discrimination, and violence, education, job opportunities and income, access to nutritious foods, and physical activity opportunities. And I'm gonna put a little pin in that one because that's been a really big conversation as we're looking at our, the latest PAYS data that we got back in December, beginning of January, the highlights report. That's been one that has really stuck out and has really been important for, you know, social service and schools for communities to look at, is that accessibility to food. So again, please drop in the chat box how social services use the PAYS, and also other ways that the education sector can use the PAYS as well. I know you all have a lot of great ideas. Again, this was not an exhaustive list by any means, just highlighting a few. And Jeff, if you wouldn't mind. Thanks. So I'm going to take this opportunity. I'm going to pass it back over to Kelly Burke. She is going to talk about our adverse childhood experiences, our positive childhood experiences, and PAYS and how they can all work together.
Thank you, Megan. And I have my eye on the time and definitely want to give our guests time to present to you their call to action and really motivate us before we head out the door. And I'm certain that ACEs is something that the majority of us are extremely familiar with, so I'm not going to go into detail. But we know data is important. We know how we know how to use it, and aligning it to the work that we do daily in our respective settings is definitely key. But many times we're addressing that big problem behavior or that biggest fire that's burning in front of us, yet we also must remember to use our data to address underlying causes. And really that's the crux of this slide here and why we're bringing up ACEs today. So when I think of ACEs, I'm sure you all are familiar with the study that was done with 17,000 people, and basically where they're taking 10 experiences or behaviors, categorizing them in 3 domains, whether it's abuse, neglect, or household challenges, because we know these experiences they may not, but they can contribute to poor developmental outcomes for children over their lifespan. And we know that ACEs can contribute and are linked to unhealthy decision-making, perhaps drug use, mental health concerns with depression, anxiety, and suicide. So things are interrelated here. And when we look at root cause, it makes me think of Section 7 of your big PAYS report, which is risk and protective factors, which kind of covers, those underlying or root causes. But also when we look at abuse and neglect, it's calling me, it's reminding me, hey, let's pull out the preliminary data that we received in December, because that data is inclusive of abuse. And as Megan has mentioned to us, that food scarcity. So, we can look at abuse and neglect there. We can, again, let's look at that data. Let's also look back at 2019, some of that mental health data, compare it to the preliminary reports highlight data. What we have now that was captured from 2021 available to you is that in that mental health space, we have past year of serious depression. We have those that seriously considered suicide. Student reported data on whether or not they've made a suicide plan within this past year and attempted suicide. So we have that data available at our fingertips from the preliminary report, and it's not going to be long that you'll be able to have your profile report coming out soon. So we know that ACEs also, CDC tells us that ACEs are preventable. We're not going to have time to click on this link, but you will have it in your PowerPoint that's sent to you. But within that, you will see CDC's strategic plan. There's 6 key strategies that actually they are suggesting based on evidence that we can prevent, or we can kind of mitigate or lessen the long-term consequences of ACEs. So Jeff, let's go ahead and jump ahead. On the flip side, when you open up that CDC link, if you're wanting to take a look there, guess what you're going to see? Something that looks exactly like these PCEs, either the positive childhood experiences, or sometimes they're named protective childhood experiences. We know that these experiences are connected to improved mental health and social connectedness as an adult. And we know that PCEs, if those positive experiences aren't provided within the walls of the home, then our children need to get those elsewhere and can get those elsewhere. And that's what programming is all about. And that reminds me to go to school climate and safety data that we're looking at in our PAYS information. And again, pulling in the prelim data, looking at past profile and what's upcoming for us. But let's see how we're doing in those areas of providing kids. Are they feeling supported with their friends? Are they connected to a group? Is there participation in traditions? Is there a relationship with at least one non-parent adult? So that's going to wrap up our PCE talk for today. Go ahead, Jeff, let's keep moving forward. Here's the time where I'd like to, I'm going to say in 30 seconds or less, that's quite a challenge, but in 30 seconds or less, I would like to revert back to Kelly. Let's start with Kelly Canally. And if you would want to share any words of wisdom your call to action for us, Kelly, we're going to turn the mic over to you.
Excellent. Thank you, Kelly. I would say just, and those of you on here, obviously you have an interest. You joined us today to learn more about the PAYS. As far as Pennsylvania Cross-Distance Prevention Work Group, we would just encourage everybody. One of our recommendations in our Risk and Protective Factor report was to use local data to assess risk and protection for youth in your communities, and to assess that risk and protection across multiple contexts and strategies. So keep looking at the PAYS data, looking at your community level archival data to make those data informed decisions.
Perfect. Thank you, Kelly. Thanks for those motivating words to get us rocking and rolling. Who's going to be up next? Josh, 30 seconds or less. Can he do it, everybody? We don't want to incorporate gambling here into our PAYS webinar, so we won't do that. Josh, it's all you.
I don't think I need to say a whole lot more than what Kelly said. Just making sure that when you're looking at your own agency's data, you're looking at your own data that you're used to having within your agency or your department, your organization. Get the PAYS data. Take a look at the PAYS data, figure out how it parallels, how it blends with the data that you're looking at, figure out where the trends are, and it truly does help to paint a really good picture of the service gaps, paints a good picture of potential protective factors that need to be established, and really that's the call to action. The data will speak for itself, I believe.
Josh, I'm so glad you brought up that protection piece, because sometimes those protective factors get lost in planning. So thanks for bringing that up. Meghan Blevins.
Sure. My call to action is really think about those sectors that are difficult to engage. Some of those were the business sector, the youth sector, and creatively think about how the PAYS data would be important for each one of those sectors in moving forward.
Thank you, Meghan. Great. Jeff Hogan, do you have a call to action for us?
I think I would think back to that picture at the beginning of the slide with the puzzle pieces fitting together, and just recognizing that none of us have all the information. None of us are able to look at our communities from every lens and every angle. Just remembering that we provide a piece through the work that you do, and then the PAYS information that you can help other strategic plans and sectors to do their work, but also think about what puzzle pieces are missing in your work and what sectors could be brought in and what pieces of information could be brought in, so that as a community, a collective community, we can complete our puzzles together so that we can see the best outcomes possible for youth in our community. And I'm thinking that there was a better chance of Josh doing it in 30 seconds or less than I am, but I'm proud of being able to do that succinctly.
Terrific calls to action, each of you. Thank you so much for sharing that and motivating us to go forward. Phyllis, I would like to just say, is there anything in Q&A that hasn't been addressed that we need to, or any words that you would like to share?
We actually have 2 hands raised in the Q&A. Jane Augustine, would you like to ask your question? You can unmute yourself. She asked early on, so she might have had to leave. So the other person who has their hand up is Stephanie Esser. Stephanie, if you'd like to unmute.
That was an accidental hand raise. I'm sorry about that.
She's giving us a high five.
There you
go. Thank you.
Thanks, Stephanie.
And that's, I believe that's it. There was a lot of really great ideas that were shared in chat. I really want lots of really great communication, and I hope everybody was able to kind of track through as folks were providing information, because it was some really great ideas.
Hey, we would love to share what's on the horizon. So Jeff, if you could please advance a few slides to our upcoming series topics, that would be great. Just kind of giving you a look at what's coming up. We're excited. We've entered a project that within the next 4 months, we will be releasing some new and improved, enhanced, exciting resources, PAYS resources. So we surely are hoping you'll join us in April, where we will be providing a PAYS resource map and walking through the how-to guide and really showcasing that. And it'll be May before we know it, where we have our hands on our profile reports. So we'll be giving a review of that in May and having a live Q&A scheduled down the road in June. And finally, some of us, we may be at different levels of our comfort with crosstab tools. So we know there's crosstab reports and there's crosstab tool training. So that's upcoming in July. So more to come in those areas. We don't want to forget about Prevention Week. So let's kind of move to Prevention Week as we're wrapping up here for today. Prevention Week is the week of May 9th. And you can see there, you know, really the purpose of that week is that all of us collectively, we are sharing the importance of getting upstream, right, with primary prevention. We want to showcase the usefulness of PAYS. We want to share the impact that our prevention efforts are having in our respective communities. So this is the week to really promote our field and all of the great work. You can visit on your own the link below. CPA leads us in our efforts there. And please take advantage. They will soon be making available an expanded toolkit. So get your community excited about Prevention Week through the use of, you know, social media posts, selfies, all of that, all of those good things. Maybe offering, getting your county commissioners to declare it a Prevention Week, a proclamation. You know, there's a template there for you as well. So be sure to visit those resources. All right, Jeff, I think Sophia will probably remind us about our evaluation. If we can click to that slide.